that's why I think it's important to have someone that practices, a provider that does integrative medicine, because you have an understanding of all the different modalities that are available for people.
Hello, and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
Back. Okay, there he is. And I'm also Jean Marie today because Jean Marie, unfortunately, is down with the migraine. Collectively, we're the hosts of PodcastDX. On today's show, we are speaking with Dr. Deepti Agarwal. Dr. Agarwal graduated from the University of Pennsylvania, then earned her MD from Stony Brook School of Medicine at the State University of New York, that's SUNY. She completed her residency in anesthesiology at Northwestern Memorial Hospital Feinberg School of Medicine. Her fellowship in pain management is from Weill Cornell Medical College, New York Presbyterian Hospital. She also completed an Integrative Medicine Fellowship at Northwestern UCSF Osher Center for Integrative Medicine. That's quite a mouthful, Dr. Agarwal. Welcome to the show.
Thank you, Lita. Thank you for having me. It's a pleasure to be here.
Thank you.
Hi, Dr. Agarwal. I'd like to start out first by asking, what exactly led you to a career in medicine?
Oh, wow. That's a question I feel like I actually haven't answered in a long time. But, I grew up in an Indian household, and I think medicine is always a very popular path to take. So, there's some thought process that goes into it. I remember when I went to college, I went with an interest in medicine, and I was very interested in women's health and neuroscience. And then I had this vow where I thought, oh, maybe I'll become a lawyer. And I spent a summer in DC. And that was a really popular summer with like Patient Bill of Rights coming out and stem cells. It was just a very big summer for healthcare. And I remember thinking, I need to be on the other side. I need to be working with patients, not kind of advocating without knowing what's going on the other side. So that along with, growing up with a mother in medicine, just having an interest in how the body heals and how it can heal itself. All of those things led me to a career in medicine.
Wow, that's incredible.
Great. Yeah, that's excellent.
So this was all as you were a college student, those big thoughts were going through your mind?
Yeah, because you have to make these big decisions based on little information when you're deciding to go to grad school, especially medicine, because it's a long road.
Not many people think that broadly, which kudos to you. That was excellent.
Well, hindsight is always 20/20.
Yes, it is. Yes, it is. I read in your bio that you did a fellowship in pain medicine with the opioid epidemic and other such issues in the United States. How difficult is it to help your patients meet their needs for pain relief, whether it's post-surgical or chronic pain?
So, yeah, I did a fellowship in pain management after an traditional anesthesia residency training. And, pain is a difficult, challenging problem in general, as we know. And a lot of times, the fellowships that we do as anesthesiologists are very interventionally based. And the idea behind that is to really curb the opioid epidemic. So in our field, we would rather learn the physiology and the pathologies that might be causing the pain so that we can go in and try to intervene them. And there's not always perfect intervention for pain. And I think what's becoming more known and more widespread and more accepted is that pain can be very multifactorial. And so it's maybe not just a simple injection. We have to start thinking more broadly about our patients and people.
Okay, good. I am a chronic pain person myself. And because I was we're going to say hooked on Tylenol because I cannot tolerate, my stomach cannot tolerate any of the harder drugs that
Sure.
they would go to. I'm a big puker. But Tylenol I can tolerate. And unfortunately, I used Tylenol to such an extent that over the years, I damaged my liver because I'm not a drinker. But now
Right.
I have non-alcoholic fatty liver disease. And the only thing that takes care of my pain, which I have discovered, is edible cannabis. Because I'm also not a smoker,
Right.
so I can't smoke it, but I can take the edibles, and that takes the pain level down to just a point where at least I can get a good night's sleep. Because typically it's when I go to bed at night that the pain is really flaring, and I think I
Sure.
discovered the reason for that is because when you're moving, when you're active, when you're up, when you're doing things, your mind is not on it. But now you're in bed
You're not thinking about it.
and now you're thinking about it. It's
Right.
like, okay, I
Right.
mean, cannabis is perfectly legal in many states, and in Illinois it is. And if this is what helps, I think that this is something that pain doctors should be able to prescribe. Do you find yourself wanting to prescribe that?
Yeah, absolutely. In the right situation, it's definitely in our toolbox for treatments.
Okay, good. I know that they're talking about it at
Yeah.
the VA, and they haven't gotten there yet, but
I work in a practice setting now where I have a lot more freedom to prescribe and talk about these things, but it's absolutely been part of my toolbox for many years. And now, it's legalized. And so it's something that we can talk to patients about easily. And there's different ways to do medical cannabis. Some people are just interested in the CBD portion of it, and some people want the actual THC portion of it.
right. We actually had a couple of guests on, 3 different guests at 3 different times about medical cannabis. One was a patient, one was a doctor, and one was a bud tender. And they each gave their view on it. But I'm glad that you're open to that type of pain relief if needed.
When you work in chronic pain, I think it's very helpful to have an open mind because pain is a very complicated topic.
True.
Complicated condition. Yeah.
Right. You also specialize in longevity and regenerative medicine. Those are 2 new terms to me. Are they indications that treatments take a more preventative, nurturing, and personalized direction?
Yeah. So just to take a step back, there's no actual specialty right now for longevity medicine. It's an evolving, I guess, subspecialty of preventative medicine, meaning that it really focuses on coming up with more of a customized or personalized health plan for someone, or looking at a patient from a more preventative approach in order to optimize their current health and also prevent from developing chronic diseases that are common to us, like heart disease, diabetes. Or if they are in the midst of developing it, how can we halt it or stop it from getting worse or progressing to become worse? And so this all falls under more of a metabolic health, and in general with general medicine, we haven't been practicing that. We've been practicing more sick care in our country more than we actually practice healthcare. And so the reason I've become very interested in that is that over the years, working as an anesthesiologist in the hospital, working in a traditional pain management setting, I see people coming in with very debilitating chronic illnesses. And over the years, I keep thinking to myself, well, what if there was a way to prevent this from happening? Or someone that's seeing me for the first time in their 80s or 90s and their spine is so degenerated. What if there was a way, if we had met in their 20s or 30s, that we could have implemented lifestyle modifications or talked about other things that could have helped prevent this from happening, that now there's no way I can reverse it. I can just symptomatically treat it.
Got it. So
And
now,
then the regenerative part of
Yeah.
it, not to become, kind of buzzwords with longevity medicine, the regenerative part of it, this is just it's in its infancy. It's an evolving field, but basically that's going to be looking at how can we use tissues and stem cells in our own blood to help heal our body as opposed to using pharmaceutical drugs.
Okay. Well, that
And
answers.
sometimes, prevent from surgery. There's
Yeah.
a role for
Right.
everything. We just need to figure out when it's right to use everything.
Got it. That actually answered my next question of what is longevity medicine. But is longevity medicine good for people of any demographic? Like you were saying, once you're older, it's really too late? Or are you hoping that it's not too late for older people?
It's absolutely good for anyone. I say the day you decide to start, your life is going to get better in general. So I do think, one thing I think is really important is I have a friend that says, longevity starts as a child. And I actually think that's really important because we often think about, longevity and anti-aging as people get into their 40s. And that's when we really talk about it, or it becomes more of a buzzword in your own community. And I really think that a lot of lifestyle habits start when you're young. And if we can teach our children, especially our environment is just changing rapidly to become one that's not healthy. And so if we can start instilling some of these habits younger, that's better. But yes, you can hop on to taking care of yourself at any stage and age. It's just really when you decide that you want to take agency and ownership over it.
Okay. Thank you.
Yeah, that's great information. Thank you. What about regenerative medicine? Can you tell us a little bit more about that?
Yeah, so regenerative medicine, as I was saying, it's making its way more into the pain community and orthopedics community. And it comes in different flavors. It comes with people using their own blood to help regenerate different parts of their body, or I should say to help with a variety of things. That the main idea is if someone has a tear or they have some pain, instead of going in and trying to get a symptomatic steroid injection, what if we can do something that actually helps signal the body to repair itself? So to rebuild their cartilage or rebuild their ligament. And the idea is to really help prevent people from going to surgery, especially those people that are surgical candidates. And even if they're not, to help prevent their injury from getting worse so they don't become a surgical candidate.
Okay.
We're going to see regenerative medicine, it's going to be part of medicine. It's just, like I said, there's still a lot we're learning. There's still a lot of work to be done with stem cells and how can we use them safely in the body. People are starting to use them. It's just that we don't have clear-cut evidence yet. Like some of the other things that we do in traditional medicine.
So it's evolving.
It's evolving for sure, but it's definitely it's definitely being used.
So
Okay.
the regenerative medicine injections, would that be PRP? Is that one that you would consider to be regenerative?
Yeah, so there's a few that are I personally consider regenerative. We have prolozone injections, we have PRP injections, people use exosomes, or bone marrow stem cells. So there's a few things that fall under regenerative medicine, and even the use of peptides. Some of these things aren't used in mainstream medicine, but I would put them all under regenerative medicine.
Okay. I like to have a few selections that our listeners can choose from. If you had if you had to have a choice, what would you start with?
So I think, that's a difficult question to answer because you want to look at the
It's
individual.
specific on each person.
Dependent on each individual person.
Yeah, it really depends on each person, what their goals are, what stage of life they're in, what kind of medicines they might be on that might preclude them from a certain injection. So for instance, PRP injection really, it's widely used right now in the orthopedic and pain world. And it's basically the idea of taking a patient's own blood, spinning it down, in order to isolate, growth factors that can help trigger cell production and stimulate tissue regeneration or healing. And then we inject it actually into that site of injury to initiate basically an anti-inflammatory response. But if a patient's on a blood thinner for some other reason, that might not be the right therapy for them. So we may have to think of something else. So that's why I'm saying it could be a little bit more individualized than that. Then if someone comes in and needs some more acute help, that PRP takes some time to work because we're looking at it from the long haul. So we may think of something like a prolozone injection. And a prolozone injection is something that a lot of people have not heard of. And I actually have, after having left a more traditional hospital setting, have become such a big believer in these injections. But basically, it's like doing your traditional steroid joint injection that you would do in a pain management or orthopedist's office. However, what we do is we use medical grade ozone. And so what is that? So ozone, we think of it as, something in our Earth's layers that are dangerous. It's basically, O2 is oxygen, O3 is ozone. It's a colorless gas, and it's been used in countries like Germany for hundreds of years. And it's been used for its anti-inflammatory and antioxidant and actually antimicrobial effects. And so if you think about it, if you put it into a site of injury or into a joint or a ligament tear, it's going to go in and initiate the same process that PRP is. It's just that PRP uses your own blood. So the process could be a little bit more dramatic, faster, but prolozone we can actually use in a more acute situation because we mix it with things that help calm down pain faster, like local anesthetic.
Okay, got it.
So I always tell people if they're interested, why not start out with a prolozone, see how it's working, and then we can always move on to another type of injection if they become interested.
Okay, thank you.
And a lot of this, and I do want to make one comment about pain management. A lot of this, these are not miracle treatments. Like you get the injection, all of a sudden you have a brand new ligament, tendon, muscle, your joint space is automatically like it was when it was 15. It's giving your body medicine, for lack of a better word, in order to start the healing process. It kind of augments the healing process. So that still means on your own, you still want to be participating in culinary medicine, putting the right things in your body, getting the right phytochemicals and nutrients, still doing all the proper movements and physical therapy that's important in muscle building and strengthening, getting proper sleep. So those things are all very important along with getting these injections.
Okay, thank you.
Yeah, that's some great news. Can I ask you, what are orthobiologics and are they safe?
Yeah, so orthobiologics basically falls under what we've been talking about when we talk about regenerative medicine. And in the way that, and this is why everything's still being studied, but the way we currently use them in the United States, they're absolutely safe, right? We're using biological substances to help a musculoskeletal injury or a joint injury heal faster. And so that could mean using your own blood, maybe aspirating some of your own stem cells. So in general, yes, it's very safe.
Okay. And
okay, thank you.
Are those injections exclusively for use before a surgical intervention?
Not necessarily. That we use them sometimes to prevent from getting to a surgical intervention. If someone, if someone's to the point where they need surgery, then that might be the better route. But the idea of these is to really start using them at a time where we don't have to get to surgery.
Okay.
But like I said, we have patients, a lot of younger patients that are interested in this, that just have, the beginnings of an injury or the beginnings of like a micro tear or little rotator cuff injury or a knee injury from skiing. And they are on top of this because they don't want to have more acute on chronic trauma. They want to try to cut that pain cycle.
Okay. I've read that the National Institutes of Health have contributed approximately 88% of the total funding for orthobiologic research. To me, this indicates that the NIH has a belief that orthobiologic research is vital. What might the future of regenerative medicine, tissue engineering, and orthobiologics look like?
Yeah, so I think it's very promising, and that's actually a very promising statistic. It's just that, there's little pockets and little communities and different belief systems. We have some physicians that are very stuck in, our traditional way of thinking. But I think as more literature evolves, more evidence evolves, this is going to be a part of medicine. Right now, when you look at the orthopedic literature and using some of these, it is very mixed. And I don't let that deter me, because sometimes an N of 1 is all you need for certain things. If you can help someone get better, then maybe it is the right thing for that person.
Great. Good advice. Hold your ground. Hold your ground and keep pushing the medicine into the future. That's the kind of doctor we need.
Yeah, and also if you're mindful of doing something that's safe for someone and it helps them, I really don't think you need, an N of thousands of people to prove that that's the right treatment.
Right. Good point.
Yeah, absolutely. So, Dr. Agarwal, kind of a generic question, I guess, but in your opinion, what role does exercise and fitness play in regenerative and longevity medicine?
It's paramount. I think exercise is something that is one of the most important medications that you can do in your daily life. And, there's kind of this old thought process that if someone were to come in and get a procedure, we would tell them, oh, don't move, don't do anything for, 3, 5, 7 days. And I have never been that person. I think there is always a role for some movement. You don't need to necessarily go run a marathon, but there is role for movement and exercise. And there's a lot of creative ways to get that in on a daily basis. And I think it's one of the most important things that everyone can do.
Yeah, I mean, again, I know it's kind of a generic question. I mean, we all know that keeping the body moving is always a good thing.
I think recreational therapy kind of entices people into moving without even realizing that they're doing it, and they're having so much fun. Take me fishing, right?
Yeah, and that's all part of, if you look at sort of these factors that create longevity, right? It's kind of what you eat, how well you sleep, how you're moving, how good your social connections are. So what you're saying, Lita, is basically mixing the social connection and the movement, which I think is wonderful. And I think everyone should find an activity where they can do something that's social plus involves some sort of movement. And that's why I'm a big advocate of things like pickleball, because it's more of a longevity sport. It's social, it's fun, it's not as high impact on your joints as some other activities are, and you socialize while you do it.
Right, right. Let's hear it for pickleball.
Yeah.
Well, now you kind of led me right into my next question, or Jean's next question. I've heard that you like to cook. Could you tell us about your early experiences with food and health, and what role does nutrition play in longevity and regenerative medicine and your work life today?
Yeah, great question. I am such a fan of what is called culinary medicine, because, food is such a big part of our culture, and culinary is a fancy word, but I love the idea of culinary medicine. And it's just really thinking about how to use your food to optimize your health. And so from a young age, I was definitely exposed to nutrition and medicine, especially because we used to go back to India to visit our grandparents and our relatives. And my grandmother was really big into this because my grandfather was a type 1 diabetic. Okay. So she was always sort of, looking for innovative ways to make sure that he was a type 1 diabetic for over 50 years. So he partly his long survival was because of what he was putting into his body, and a lot of it had to do with his food. So just having that exposure that, all these herbs and spices, and what, vegetables, everything that you're putting into your body, they do play a role. There are chemicals and nutrients that are important in different reactions that are taking place in your body. And I that's something that we don't think about. I think we think, oh, if we take a vitamin, it's going to help, or if we take a supplement, it's going to help. And yes, it can, because we're not able to necessarily get everything from our food. Our food quality is also questionable these days. We have to be very careful. We don't even know everything yet. We don't know what our soil quality is. We don't know where a lot of our food's coming from. We don't know what the micronutrient status is of everything that we're eating. So while we do need supplementation, sometimes getting it in its natural form, and I can't necessarily prove all of this, but getting it in its natural form into your body is just very helpful in every single biochemical process that's happening.
Well, I mean, that
So
makes sense.
I had that early exposure.
Yeah, that makes sense, because I mean, the people, when we first started being people, we didn't have supplements. We went out and we picked and we chose foods that would keep us healthy.
Absolutely. And my mom was always, she loved different vegetables and different colors and like making food, seem aesthetic. So I kind of just grew up around that. And I remember when we were younger, we could never have pizza at home without having it with a green vegetable. So it was always this tug of war and fight. And she used to cook Brussels sprouts, which no one really did back in the day. It wasn't that popular.
Uh-huh.
And it's funny now because she'll joke and she'll say, when you were young, you and your sister never wanted to touch Brussels sprouts. And now she's like, it's the new popular vegetable. So I did grow up around that. And I am very pleased that I think these ideas of kind of eating the rainbow are becoming more mainstream and people are really adopting that idea. Oh, and to your question about, what it has to do with longevity and regenerative medicine, food is the one thing that you are putting into your body like almost every single day, right? So it's what fuels us. So we really have to think about what we're putting in, because it could be either toxic or nutritious. And it's I hate to put it that way, but it really is that simple. And there's a balance. Like we're going to eat things that we know that are not always good for us. But there's definitely a balance. And I think it's really important to be aware of that. And it's just like our car, right? Some people go to great lengths to take care of their car and, you get your oil change and you do whatever mechanical work to keep it running well. And that's exactly the way we need to think about food and fuel going into our body.
All right. Let's only use premium fuel.
Yes.
Dr. Agarwal, could you please tell us why you believe longevity medicine and regenerative medicine are essential for a patient's complete care?
Yes, I think that, longevity medicine is really just us practicing medicine the way we do, but it's looking at it in a little different light. We want to look at how we can set people up for the future, because staying out of the hospital is just so much better. Like, I don't think anyone would disagree, right? And I just don't think we think about those things. We don't think about those things when we're younger, how things evolve. Like every decade, I think there's just a lot of evolution in our body. And when you end up in the hospital, you become a very vulnerable person. And there are so many other things that can go wrong. And, we do great things in medicine and the hospital does wonderful things too, but it's just the reality of the situation. I've been in the hospital system for many years, and there's just a host of things that can go wrong. So the more you can keep yourself out of the hospital, the better off you'll be. And that's why I'm a big believer in this longevity model for medicine. And I do think with regenerative medicine, there's a lot of hope and promise, going in and getting a surgical intervention, while it's absolutely necessary in certain situations, there's also a lot of things that can go wrong. And a lot of my patients will go in and get a back surgery done, but then they'll end up in more chronic pain. So nothing's foolproof, right? So the more we can go back to basics and take care of ourselves and just really implement day-to-day good, healthy habits, the better off we're going to be as an individual and as a collective society. And in general, it just has so many implications, right? It has so many implications on our national budget, for our children, the whole wide spectrum.
Right. Absolutely. Thank you.
Yeah, absolutely. I mean, it seems like it might be common sense, but there's a lot more to it. You take care of yourself now as best as possible. You're not looking at some of these other things down the road that you might not necessarily have to have been going through.
And it's just, and I like to call it back to basics medicine, because a lot of these things we're talking about, like you're saying, Ron, it seems like common sense, right? But yet it's actually really hard to eat well all the time, right? And part of it is just access to what we have, access to food, access to what's in our grocery stores. You know, people are busy these days. Time is a commodity too. It's not all, I do think it takes work to try to stay healthy. It does take
absolutely. I mean, I probably in the last 5 or 10 years actually started looking at the labels on food to see what exactly is in there. I never did that before, but then you see like how much sodium is in something, or you know, how many carbohydrates. And going back to what Lita was talking about earlier, you know, back when, you know, caveman times and so forth, we had, you know, natural food, not all these, you know, additives to it to keep it fresh or to keep it longer. And you don't realize the long-term effects on your body that stuff has. And it's really difficult trying to read those labels and try to figure out not what's good for you, but how you can manage that in your lifestyle.
And that's why I bring it back to the children, right? When did we learn how to read labels? What should we be looking for? Like, these are all things that seem so basic, but actually they're pretty challenging, and a lot of people don't do it. You know, like my sister has this policy that she looks for things that have 5 ingredients or less on a label to know if it's actually worth looking at, right? But those are really important things. And, you know, we like all these condiments and salsa and this and that. And the more we don't make and know what goes in it, there's actually additives, preservatives. Like you have to be really careful. And those all add up over time, because you're not just eating the condiment or the salsa or something, you're eating many things, and they all contribute to what's going into your body.
Right. And once is one thing, but like you say, over a long period of time, that longevity can take an effect.
Right. And then if you learn how to use some like different spices and herbs, or like, you know, understanding like a good quality cinnamon can help you with blood sugar control. Those things are nice, right? So I add a little cinnamon to my coffee every day, right? I'm just trying to use things that are natural in our environment that can help what I'm drinking taste better, but also give me some health benefits at the same time.
Right. That's excellent. Thank you. Now that we've discussed the probably just the basics of longevity medicine and regenerative medicine, now hopefully our listeners have a better understanding of these topics. This actually is an excellent time to remind all of our listeners of our new endeavor. In order for us to be able to better serve our guests and listening audience, we are now working as an affiliate with a major medical supply warehouse here in the United States. Let's pause for the effects. Thank you. You will actually find affiliate links on our website and learn more about this in upcoming future episodes. I just had to throw that PSA in there.
Okay, thanks, Ron. Dr. Agarwal, I have a 2-part question. How difficult is it for a typical American to receive medical care in the areas that we have been discussing, like longevity and regenerative medicine? Are they mainstream yet? How soon will they be mainstream? How many physicians are treating patients with these modalities? Okay, that's more than 2-part question. And secondly, is this type of specialized care covered under health insurance, or can someone use their flexible spending account for such care? That's like a 5-point question.
Good. Yeah, so those are all good questions, though. So, you know, it's not difficult to receive this kind of care. I wouldn't call it mainstream. I think you really do have to seek out physicians who are doing it. let me separate the regenerative component. You absolutely can find physicians. It is being done, like we do it in our clinic, which is more of a boutique integrative medicine clinic, but hospitals are doing it. If you go to all of the major hospitals in the city, they're all participating in some sort of regenerative medicine. In terms of more of the longevity and lifestyle medicine, that I think takes a little bit more searching, but there are people that do it. You can do some of this on insurance, like there's people that are practicing lifestyle medicine. I know at Northwestern. However, it may be more limited than you being able to do it in a private setting. And there are a few of us in the city that do have this mindset where we practice more from a longevity mindset. You can always use a sort of like a health savings account to do that kind of workup. This is one of my beefs with our healthcare system, is some of these things that seem so appropriate to cover, it's really hard to obtain that. And so I think until this awareness builds, and I think it will over the next few years, it's a little bit of a tug and war between what you can do on insurance and what you can't. Regenerative therapies right now, as it stands, are not covered under insurance.
Okay.
So that is something that is often out of pocket.
Yeah, it does seem counterintuitive, doesn't it?
Absolutely. And that's,
I mean, if this kind of medicine is going to keep you healthy or
Yep.
get you to a point where you're healthier, then you don't need the medical system. Is that why? I'm just playing devil's advocate, but
yeah, no, that's absolutely why I like to call it sick care over healthcare. I want to push this model of healthcare. And, that was part of the frustration when you're working in a traditional healthcare system, is wanting to do that. And you can't do that in a hospital setting. I think it will absolutely change that way, but it's going to take a lot of time.
okay. And do you
So
anticipate
let me
more
see if I
physicians?
answered.
Yes, no, you got them all. You did.
Oh, absolutely. I think I'm seeing, like the younger, newer generation of physicians coming out. And I definitely think, first of all, medical school education is slowly training. And second of all, there's just more of an awareness of what integrative medicine looks like, what functional medicine looks like, what, regenerative medicine. Even if someone's doing, let's say someone decides to become an orthopedic surgeon, their exposure is going to be totally different. It's going to be surgical interventions, and I'm sure it's going to also involve some of these orthobiologic treatments too. So I think that the face of medicine will hopefully look different, but it will take probably a generation to cycle over.
Okay.
Right.
And what advice do you have for patients that are getting ready to see a longevity or regenerative healthcare provider for the first time? And also, what should one look for in those type of healthcare providers?
Yeah, so I think the first thing is making the decision that you want to take agency over your health. That's really important, and that you're open to hearing and seeing what might come up while you do this workup. So that's number one. I think number two, it's really helpful to have goals in mind. Like what is it that you're trying to accomplish by doing this? And then after that, really honing in on change. Like even if they're micro habits or micro changes that you make, I think that's really important to go in with that mindset, because otherwise you can get all your lab work done. You can see, oh yeah, my advanced lipid panel doesn't look great, and this is what I should do. And you can leave and then just go back to your regular lifestyle. And then that's not really helping you get better, but you have the awareness. But really, I think making those changes is really important. So having those things focused in your mind before you go in is helpful. And it'll also help tailor your visit a little bit. And I think when you're looking for a provider, you'll know that it's the people that are really interested in this. There's only a few in this area, but you'll have an idea. It's like I said, there's no formal specific training. There's a lot of different avenues to get to longevity medicine. So a lot of people end up doing, like stitching their own coursework together to become really knowledgeable in the space.
Okay.
Okay. Actually, I have a follow-up to Lita's question, Dr. Agarwal.
Sure.
What advice do you have for up-and-coming medical students when it comes to possibly choosing a career in longevity or regenerative medicine?
Well, I think my biggest advice for medical students is, first of all, some of the things that we learned really early on, like biochemistry and physiology, and we kind of just learn them and move on and learn so many other things. A lot of those things are so important to actually understanding root cause of disease. And so I would say, really pay attention to that and really think about the future of healthcare, what root cause of disease looks like, and how we can actually prevent and treat that. And I think that is going to set our, field of medicine up in just a very different way, because the thought process is automatically going to change when someone's going in to visit their primary care, their internist every year. It's going to drive different lab work. It's going to drive people to look at things differently and process their patients differently.
Right. It's kind of rather than fixing, it's preventing.
Yes.
Starting
Okay,
early.
great. Thank you.
Yeah.
And Nita, one thing I did want to say, because this happens a lot. So there's certain lab work that you can do that we don't traditionally do in a hospital setting that serve as metabolic markers, and not all physicians are really aware of it or don't know how to interpret it or not even into it. And so I do find it a challenge, when you are going into your doctor's office. Sometimes you'll ask for that lab work and they're very reluctant to do it. And so that's why I think it's important, if you're interested in that approach, that you find someone that's very open to doing all of those things, and then will also help you in turn interpret it.
What are your thoughts on alternative medicine, and what role do they play in your practice? Things such as acupuncture, acupressure, Reiki. I mean, I could think of a couple, but not many.
Yeah, so I like to think, there are terms and ways to define alternative medicine, but I like to think of it as that we're basically saying that we're combining, our traditional Western medicine and basic lifestyle measures that we talked about, and mixing them with other health systems from around the world. And so just because they may be considered alternative to us in the US doesn't mean that there are practices that haven't been used for hundreds, thousands of years successfully in other parts of the world. So to me, that means working with someone, also seeing where they're at. That's a really big part of integrative medicine, is understanding what they may be interested in, what their needs may be, because the same person could participate in acupuncture and Reiki and, Tai Chi. But not everyone has the time or resources to do all of that, but they may have a specific interest. And a lot of times you can get the same effects from different types of quote unquote alternative medicine. So that's why I think it's important to have someone that practices, a provider that does integrative medicine, because you have an understanding of all the different modalities that are available for people.
Right.
And what whole health system from around the world may best suit someone's needs. And people come in with certain interests too. Someone might be interested in traditional Chinese medicine. Someone might be interested in Ayurvedic medicine. Someone may just be interested in botanicals and supplements. So it's really about learning what the patient's wants and needs and desires are as well.
Okay, very good. What does this upcoming year look like for you in your practice?
Oh, that's a great question. And so I am really doing something a little unique with someone of my background, and I'm trying to build a integrative pain management practice. So we have all the tools that we would do in a traditional setting with interventional pain, plus we have a whole other set of options. And we talked about some of those, like the prolozone injections, the regenerative, talking about botanicals, just basic metabolic management, just optimizing your body so that you're functioning well. And then the other part of my practice is really doing more of this preventative longevity work.
Okay.
So we're really excited. Those are the things that we're building in the practice. And, we always have our pulse on new things that are coming out. We're starting to use peptides and other exciting things in the office. So looking forward to all of that in 2023.
All right, great. We may have
Yeah,
to be.
that's great.
We may have to be visiting. 'Cause-
You absolutely should come by.
yes, absolutely. I'm going to be doing that because my chronic pain has not gone away yet.
Please.
Well, thank you very much for joining the show today. How can our listeners learn more about you and your practice?
Yeah, so I'm at Case Integrative Health,
Right.
which is on the border of Westtown and West Loop here in Chicago. But our website, caseintegrativehealth.com, is a great place to go and has tons of information.
All right. I'm going to put a link for that on our website.
Perfect.
Well, that just about wraps up this episode. Don't forget to check out our new and improved website and our affiliates.
And if you have any questions or comments about today's show, you can contact us at podcastdx@yahoo.com, through our website, podcastdx.com, on Facebook, TikTok, Pinterest, and Instagram.
And if you have a moment to spare, please give us a review wherever you get your podcast. As always, please remember that this podcast is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions that you may have regarding a medical condition or treatment before undertaking a new healthcare regimen. Never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Till next week.